This is always like in grade school. Nobody wants to come up to the front, so we've got the mayor's seat. Dr. Trevino, your seat's right here. Beth, your seat's there. All right, good to go. Well, welcome everyone. Yeah. Let me tell you, the mayor has been running all over the place for weeks and weeks and weeks in a row. I was having to introduce him, though, to our county health officials back there. I don't think he's met them yet. No time together. Thank you all for coming. This is an incredibly important time for the Health Sciences Center, for Texas Tech University, and actually for not just the Lubbock community, but for the West Texas community and beyond, with this initiative that's been going on now for several years. If you talk about rural health in general, but mental health in particular, it's something that has never gotten the attention that it really needs to get. If you think about trying to get things done in an area like West Texas, it's always a little bit more difficult. And it's not anybody's fault, but the fact is we cover a large geographical area that is sparsely populated. And so when you're in Austin trying to work through initiatives and things like that, very rightfully, their mindset's always about the eastern part of the state, where you have the vast majority of the population. And so one of the jobs that all of us in this room have is that we're reminding our friends in Austin that while we may only have 15% of the population west of I-35, it's that 15% of the population that does so much, not just for this region, not just for the state, not just for the country, but quite literally for the globe. And so making sure that the folks out here have access to great care becomes critical. If you lay on top of that the issue with mental health illness, something that people don't like talking about anyway, it makes it that much more difficult to get folks the resources they need. Because when we think of the challenges out here with things, we're generally thinking of challenges with some of the other medical conditions, high blood pressure, diabetes, heart disease, cancer, whatever it might be. But mental health is one of those things that because people don't like to talk about it, because families don't like to talk about it, because communities don't like to talk about it, it's this hidden disease that nobody ever really deals with. And yet we've been extremely fortunate out here over the course of the past several years because we've put together groups of people, not just from the universities, but from the communities around that are involved in this, that live this day in and day out. We're going to hear from some of those folks today. We're going to hear from the mayor, Mayor Dan Pope. We're going to hear from Dr. Nancy Trevino. We're going to hear from Beth Lawson. We're going to hear from Lori Rice Spearman on initiatives, I won't say an initiative, but on initiatives that we've been working on in conjunction with the community, with the survey done by the Meadows Foundation, with hard work being put in by folks like Dr. Billy Phillips, Dr. John Opperman, to make this thing a reality. We are now poised, we're now in a position to be able to hand this care to people that need it in a way that quite literally before the COVID-19 crisis started, we really were not in the best place on how to really get this care out to folks. But now, because of COVID-19 with telehealth, we've really moved forward by leaps and bounds. And this is the perfect type of problem to address with the technology that we have. So I want to thank everybody for coming out. Next, we're going to hear from Dr. Lori Rice Spearman, the president of the Health Sciences Center, and we'll be taking questions toward the end. So let me do my job. I'm supposed to clean this. And then according to Dr. Trevino, I am to take this with me. Thank you all for coming out.
Thank you, Dr. Mitchell, and what a great collection of mental health providers across our city. We're so grateful to have you here today. We are pleased to house the Texas Tech Mental Health Initiative within our School of Medicine, Department of Psychiatry, and we're grateful to have Dr. Nancy Trevino leading this initiative. This structure provides an administrative home for this critical endeavor for our university and our community. The School of Medicine and the Psychiatry Department are already invested in the community and have quality resources and faculty, such as Dr. Sarah Wakefield, who is the chair of the department. Dr. Wakefield will help move this initiative forward and ensure collaboration both clinically and academically within the schools of nursing, health professions, pharmacy, and our Graduate School of Biomedical Sciences. I fully expect in the coming years for the initiative to become an institute and leader in mental health for the Texas Tech University system and West Texas. In the meantime, through the initiative and the West Texas Mental Health Collaborative working together with the findings of the Meadows Need Assessment, we are going to see great changes for our communities, and no one can be more excited about that than those of us right here at the HSC. We know that true health must take a holistic approach, integrating physical, mental, and social well-being. However, one of the findings shared from the Meadows Report was that mental health needs continue to be cared for separately. We would like to be a part of developing a model that is created right here at the HSC, where we integrate caring for the mind and body together. One part of that model would be how we prepare and train healthcare providers to take a collaborative approach across the spectrum of intervention, prevention, treatment, case management, and recovery. Through the Texas Tech Mental Health Institute, our initiative, we can be the convener of such a model, bringing together the extraordinary mental health care resources across the system and the greater Lubbock community to build a synergy around true health care that would serve the mental health needs in a judicious way. I believe together we can accomplish that. HSC, we are committed to being a part of the solution to mental health care and to actively seek community partnerships through the West Texas Mental Health Collaborative. Several of the participating members are represented here today, and I want to share who those are. The City of Lubbock, Texas Tech University, Community Foundation of West Texas, Covenant Health, Lubbock County, Star Care Specialty Health System, and University Medical Center. Today marks a significant step forward for our mental health initiative, and I'm grateful to those whose work has brought us to this point. Thank you also to the members of the West Texas Mental Health Collaborative who care deeply about the health of our citizens and our community. We appreciate your partnerships and all you do, and I look forward to our future together. Mayor Pope.
Thank you, Dr. Rice-Spearman. It's nice to be here this morning. Ted, I think we find ourselves outclassed by a lot of really brilliant women. I was just thinking about it, you know. Lori, Dr. Trevino, Dr. Wakefield, Catherine Wells, who so ably runs the city health department, the city county health department. Our friend Cindy Jumper back there, Dr. Jumper. It's I guess we're lucky guys. I would be the one in that whole group that would, you know, if there was a which one doesn't belong, it'd be quick. And Beth Lawson certainly be me. They would say, "What in the world is the mayor doing in the middle of all that?" I want to build on what Lori said. The collaboration in this effort to me is what's so important. And I like the fact that collaborative made a part of our new. Our new branding, and because I think from day one, when Texas Tech on the point, the system, you know, the university led certainly the Health Science Center. I don't want to leave anybody out, but the phone call I got was from Tech saying this is what we would like to do. You know, Covenant UMC both jumped in together. I remember the first meeting was Chancellor Duncan. We had a pretty interesting discussion up in his conference room. You remember that? You remember that one, Ted? But it was good to get those guys on. The city and the county then were able to come together. Certainly, Star Care, who leads the way with mental health efforts in our region, as part of their charter, and then finally the West Texas. The Community Foundation of West Texas, whose one of their goals is to to collaborate, to convene people, and they've been there since the very beginning. So Steve, thank you for that. You know, West Texans are humble people by nature, and we don't like to talk about what ails us or what we do well. And mental health fits in that bucket, and it's something that's been taboo to talk about. I know personally it took me a long time to get to the point that realizing that counseling and talking to somebody about what might trouble you or trouble your marriage is something that makes you stronger. It's not a sign of weakness. And the idea, and one of the things that I take away from the Meadows Report is this idea that we don't need to keep primary care and mental health care separate, that we've got to bring them together, that we need to think about that, think of it through that lens. And I was thinking about our policemen, our folks that work for LPD, men and women that we offer so much mental health training to today, and it's a little bit about what they do. They don't just go on a call and do law enforcement, or just go on a call and do mental health, or frankly social services too. They show up and are prepared to deal with all of that, and that's what we need to work with people to best understand, that when you're sitting down for your annual, that you're having a discussion with your internist or a physician's assistant or your family practice doc, that you're talking about more than just, your achy left knee. And so it's exciting to work together in this effort. The city is convinced that this is the right way to go. So on behalf of Latrell Joy, Councilwoman Latrell Joy, who's sort of was shoulder to shoulder with me on this effort, and who is watching us this morning, and Catherine Wells, who's been an active part of it. We're excited to be at the table. We think there's much work to be done, and we're ready to go to work. So thank you very much for letting me share. Might take more than one of these to clean up after me. And I am introducing our very capable CEO of StarCare, Beth Lawson. Beth?
Thank you. Chancellor, President, Mayor, my distinguished colleagues, I'm so excited to stand before you today. StarCare Specialty Health System is honored to be a founding member and founding partner of the West Texas Mental Health Collaborative. Together, we will make strategic leaps to and improve the access of the world-class mental health treatment already available in our area. Knowing that 1 in 5 adults will have a mental health challenge in his or her lifetime, it's 20% of us. It's not only commendable that we as partners have come together, it's just simply the right thing to do. As a world-class medical hub, Lubbock is uniquely positioned to revolutionize how mental health care is delivered and made available to all citizens. At StarCare, we focus every single day to be a beacon of hope for people who most need one. We discovered a long time ago that without hope, recovery is impossible, regardless of what you are recovering from, be a death in the family, a divorce, a devastating diagnosis, or simply just the blues. You don't know what to do. You need hope. Accordingly, I will leave you this morning with words from Christopher Reeve, who was my generation's Superman, and I think some of you too. Once you choose hope, anything is possible. Today, we as our West Texas partners and collaborative invite you to join us in choosing hope. The only shame in mental health treatment is not getting that you deserve and that you need. Thank you. Hey, Dr. Trevino, my new best friend. Well, except for and
I just wanted to thank everybody for coming in today and showing your support, not just of the Texas Tech Mental Health Initiative, but also of the West Texas Mental Health Collaborative. So all of our great partners in the community, including our friends at Star Care, my new best friend, my other best friends from our Texas Tech system, Texas Tech Health Sciences Center, Texas Tech Main Campus, Mayor Pope, our county officials as well. They had some obligations today with their budgets, but Judge Parrish and also Commissioner Bill McKay have been shoulder to shoulder with all of us doing this work. Kano McWinney also, we want to thank him for his work and his expertise starting this and bringing everybody together at the table. Steve, of course, from the Community Foundation of West Texas, Covenant and our partners there, Lee, and also our friends at UMC. So everybody has been vital to helping improve mental health care efforts within our community. If you would like to get involved with this, those of you guys that have taken some time out at home want to be involved in this, you can go to the Texas Tech Mental Health Initiative website, and my email is there, so you can contact me directly and we can get you plugged into the right area. We also have the entire Meadows Report available for the public to review, and we have a smaller summary for those of you who do not want to go through the entire 151-page document. So thank you very much for joining us today. If there's any questions, we can take those at this point. Okay. Thanks, guys.